So, 4 ideas we want to pitch during the meetings are for technology which kind of stands especially for this broadening idea. So one thing is virtual reality, and you will see in a few minutes, you will see the idea of a quite old psychiatrist who's coming up with a new way of, and a very innovative way of dealing with one of the hardest things to do in LLM, dealing with people with chronic disabling voices, very aggressive voices, using a virtual reality approach. Virtual reality actually is broadening the scope and may broaden the scope for psychotherapy, especially also in trauma therapy, and opening new ways of interactions, and this is the avatar, for example. And we will have a wonderful presentation from the work from our colleagues in Quebec later on. The second piece is artificial intelligence. This is also going far beyond just collecting data. It's about learning system, and the opportunity we have with email health is you can not only teach the users, you can also build systems which actually understand your needs much better in a normal way. And artificial intelligence is an old technology. It's out there for probably 30 years and more. I know. I remember Weinstein's first computer-based intervention or psychotherapy intervention. But it is an added value because it brings a more dynamic component to the whole business, which is probably sometimes more dynamic than the face-to-face interaction you have with a few very overstructured psychotherapists. And it is also a very good tool for knowledge exchange, which is very helpful. The third thing, which I would love to promote and see and also work with more in the future, is the whole notion of gaming. Come on, our kids are... It's a very bad example, sorry. Please turn off your cell phones. The gaming is, if kids are using that hours and hours, are reinforced by that, and are really fascinated by that, then there must be something to it. And I think it's a great learning tool, and we will learn from our colleagues from Ontario today also how to use that as a general tool in healthcare. And how to integrate that. That's another dimension to e-health, beyond just collecting data or producing nice websites with a linear level of information. So simulation is another part of that. And the fourth part is integrate system solution instead of just specific technologies or specific topic. Think like a client coming into your room and what are the needs and what are the different steps you need to fulfill, what do you want to involve, how do you want to connect. So think dynamically and think from a system perspective to help people really to get the need and to get their needs addressed and to get the support they're really looking for. So, and this is something we're working hard on, and we will show you something tomorrow about a website addressing, a web hub addressing youth with mood challenges. I mentioned in the beginning, and I could talk on that for quite some time, be sure. I won't do it, but I want to. Mention it, I think, because we need to think beyond technologies. If we're not thinking beyond technologies, the whole thing will be a dead end. And we need to learn also from our mistakes over the last decades. So healthcare is explicitly driven by paradigms of care. And it's very much, acute care is in the center. We have a very paternalistic view of medicine, so I tell you what's right for you, and you have to do it, and if you do it, I'm assessing your compliance, and that's it. not going to work. It's not convincing our kids in school, and it's not convincing our clients in here. And I think the point is we need to provide better solutions, and we need to change how people are addressing it. And empowerment for me is the key word we need. And we had this as part of this mentioned workshop at CHR, that empowerment is such an important tool. But we need to learn how to empower people and how to understand people and how to address their needs where they are and take them up. The main goals of intervention is to build skills and resources beyond the crisis. And patients and peers and their families need to be able to act based on these programs, not taking over, but being encouraged and being worked. The system should work in support of patients and not in support of the system. I think a lot of things we are doing is self-referential, and we need to change that. Actually, I know that quite a number of my colleagues are embarrassed about patients coming in. So I know the side effects of this medication you prescribed to me, and I'm not okay with it. I don't want to take it. They are better informed very often and quoting literature and all that. I think that's good. That's good. So it's going beyond the CME system. So the clients are challenged by their patient, and they should like it. I think, and that's something I want to really support and see supported by email health solutions. And EMH needs to work on informed decision making, on self-determination, and like owning your own life and owning your own health. And we need to be not only understanding that, I think we need to support that. We are service people. We need to service people and not to tell them what's the right thing to do. We need to convince them. So the future is digital, as you probably are aware. So I think the iPod is a wonderful example, and that's the reason I'm quoting that all the time. It was not so long ago when we ran around with ghetto blasters and had enormous music machines in our living room. So and now we have this little digital device which changed actually storage and distribution of music. Music was pretty much the same. Why don't we start thinking about healthcare delivery and email health in a similar way? And I think about, so we are a small crowd today, but there will be an enormous interest, an enormous crowd in the years to come. And you are part of a pressure group to make that happen and to realize it in the right way. So you can feel very comfortable. You are part of being in the pool position. Like this little gentleman who is really well prepared to blow a big horn in the near future, and that's what we really need. We need to encourage young people to learn from our mistakes, but also probably build some synergy with our knowledge and what we are able to deliver. And part of that we will hopefully be able to discuss today and tomorrow. And I think also it's snowing and it's cold and it's early and dark. I think we're looking into a bright future in this area, and I'm happy that we made it here from Australia, from Ontario, which is nearly as far, and from other nice places in the world, Quebec, not to forget. And I think we will have a very nice conference and a lot of very inspiring discussion. Thank you for coming.